Thank you, Prof. I'll give an overview of the treatment for COVID-19, and my colleague will go into details of the various aspects of the treatment. So this morning, I did emphasize that the viral and inflammatory responses are very key to managing COVID-19. So the symptoms, they follow the same pattern of the viral and also the inflammatory responses. So if we see early in the beginning, you have a high replication of the virus. And with that high replication of the virus, then you also now have a reactionary inflammatory process which is going on. So because you have a high amount of viral replication happening, that is the time that you need to maximize the use of antivirals. I remember when we had, when we just got remdesivir, there was this issue of remdesivir being used for those people with severe COVID infection. And Zambia, in fact, I think I may have been a guinea pig, Prof. When I had COVID, they started me on remdesivir, but I had mild symptoms. When that time, it was indicated for severe symptoms. Dr. Civilian and Dr. Foloshi with Dr. Newma, they started me on those antivirals, which has now proven true that really you have to give the antivirals in the early phase so that you can reduce the viral replication. Then as the inflammatory process also kicks on, that's when you need to give the immune modulators. And then when you are giving the monoclonal antibodies, they could also be given in the early phase. But right now, the hallmark in early disease for treatment is the use of the antivirals. Now, this is just the treatment overview of which drugs can be given, and my colleague will go into details with those drugs. In the non-severe disease, this is following the WHO classification as opposed to the other classifications, which are 4. The non-severe, those are the ones that you can use the antivirals, Paxlovid and nematrelvir with ritonavir combined. Then also molnupiravir as well can be utilized in this early phase. But the people that are supposed to be given those are those who are at risk of developing severe COVID infection. Remdesivir can be used in the non-severe, but can also be used in the severe cases. In the early phase, you can use it for 3 days, then can be used that for a prolonged period in those who have severe symptoms. So remdesivir can be, is the only antiviral which can be used in those with non-severe disease and also with severe disease. But during this time when someone has severe disease, the inflammatory process is going up, and that's when you have high needs for oxygen, and many people have pneumonias at this time, and they also have signs of severe respiratory distress. So immune modulators start kicking in as well in terms of their use, so corticosteroids can be used at that time, and also IL-6 receptor blockers. In this case, some drug which will be discussed in detail, tocilizumab, can be used, but tocilizumab can be used all the way into critical disease for those that have shock, for those that have ARDS, then baricitinib as well can be used. So those are immune modulators, the steroids, the IL-6 blockers, and also the JAK kinase 2 blockers, the baricitinib. Which I think to me is one of the most, I think, wonderful drugs we have for COVID, for those with severe and also critical disease, and it's an oral drug. I think the response is very good. This is just an overview again of the management options. We have the supportive management options which can be given. Isolation was discussed earlier here but also symptomatic treatment, antipyretics, analgesia, make sure that someone is well hydrated, and looking at complications and also monitoring. For non-severe disease, as indicated earlier, nematrelvir with ritonavir, because Paxlovid can be used, the molnupiravir, the remdesivir. Those are monoclonal antibodies. We can just, the monoclonal antibodies, no longer using them, especially with the Omicron variant and also the subvariants, the response is not there. So you can forget the use of that fourth drug, the monoclonal antibodies. Then for severe disease, oxygen and the steroids, remdesivir can be used, and also thromboprophylaxis with heparin, baricitinib, which is a JAK kinase 2 inhibitor, and also tocilizumab as well, the IL-6 inhibitors. These are the supportive measures which were already discussed. Then the rationale for treating the non-severe disease is to reduce the progression to severe disease, but also to reduce the burden on the healthcare system. And essentially, we need also to reduce the hospitalization and death. That's the goal why we have to intervene early and give the various drugs for those with non-severe disease. Then for the outpatient management, you have to look at, does someone have risk factors for severe disease? So if they have no risk factors, then those are the people that you need to observe. Then if they have risk factors, then you need to look at for how long have had the duration of symptoms. If it's less than 5 days, then you need to consider giving them the antivirals, and my colleague will go into those using the test and treat concept, where I use Paxlovid, but also you can use molnupiravir in such cases. So this is the whole scenario for outpatient COVID management. We just want to prevent progression to severe disease, but emphasizing again the use of those oral antivirals has to be in the patients that are at risk of developing severe COVID disease. Then there is need to schedule the telehealth follow-up, and Dr. Foloshi will likely refer to that, so that those that are either on treatment or those that may have complications as well, you can use the telehealth services for you to monitor them. Thank you so much. This is the end of my presentation, Chair. Thank you.